All right, guys, continuing with the third part of GI function, and with this one, we may start on some of the pathologies. Um, we spoke about the small intestines briefly and how digestion and absorption takes place, and the importance of the minerals and the absorption of the small GI. We left off at the terminal ileum, and now we're getting into the cecum. All right, there's an ileocecal valve, which allows the passage of the digested food and chyme to pass through into the large intestines. Okay, by the time that food is entering the cecum, it is still in a, how do I say, it's still not well put together. Okay, it is partially dehydrated. As a matter of fact, most of it is already dehydrated. And what happens is, now at the cecum, you have the accumulation of what is going to begin as bulk. Okay, bulk formation starts at the cecum. So your feces starts accumulating here. The actual stool formation starts here. Everything else is basically chyme and basically dehydrated and denutrinized food, and now you have it conversion into stool. Let's talk about our natural flora real quick. We have obviously a variety of bacteria in our colon. Okay, in our cecum all the way to our anus, the bacteria is tremendous. Okay, about 40% of the actual size and weight of your stool, maybe a little bit less than that, but it's almost half of your stool, a little bit less, is actually bacteria and byproducts of bacteria. Okay, so your stool, a big portion of it is bacteria, and usually it needs to be like that because bacteria replicates like crazy. Bacteria is constantly replicating, and they get nutrients from your food just as you get nutrients from these foods. Okay, so every stool movement also eliminates excess bacteria. All right, which is why it's so important to have regular bowel movements. Okay, that's one reason. You have your appendix over here, which hopefully will never give you an issue in life, but like we'll speak about later on, some issues can happen, and you could present with appendicitis, and hopefully it doesn't rupture and cause a peritonitis. Dehydration becomes even further in the large intestines. Okay, now this is where fiber starts to play a role. Okay, fiber is needed, and I'm gonna mention one disease right now of diverticulosis. Okay, diverticulosis is a weakening of the pouching of the colon. Okay, yes, genetics does cause diverticulosis, and it's a factor for diverticulosis. But aside from genetics, fiber, constipation are factors for diverticulosis. Okay, and increase the chance of diverticulitis. Okay, so diverticulitis is inflammation of that outpouching. We will go over that when we start going over pathologies. So diverticulosis, if for to prevent diverticulosis or reduce the risk, okay, I'm not saying you're guaranteed prevention, but to reduce the risk of diverticulosis, a high fiber diet is definitely something you want to be on. Let me explain why. Fiber is not digested. Soluble fiber and insoluble fiber, they may be partly broken down. In other words, maybe let's say you eat an almond or some seeds or some vegetables. Depending on the texture, some get broken down maybe 3 or 4%, like the almonds, and they produce a nice little viscous oil, and it lubricates your intestines. Okay, lubricates those microvilli and villi that were working so hard to absorb everything. So it's good for you in that sense. Another thing that it does is that in soluble fiber actually binds bile. Okay, and remember, bile is mostly made out of cholesterol and of course bilirubin, biliverdin, and some other salts from your actual body. But the important thing here is to remember, as we'll discuss in a nutritional video later on, that bile does get sequestered by soluble fiber. So soluble fiber hugs bile, gives it a big hug, and doesn't let go until you go to the bathroom and pass stool. So to help lower cholesterol, now you understand how it is that fiber can lower cholesterol. Because if your gallbladder and your liver are producing bile, some of it's used to absorb fats, but you eat good fiber, a good amount of fiber, which would be 30 grams or more a day. The more you eat, the more fiber you should add. So if you're a bodybuilder and you're trying to gain weight, and you eat 3,000 to 4,000, 5,000 calories a day and a lot of red meat, white meat, well, go ahead and eat more fiber. Forget about the 30 grams. 30 grams is the minimal amount that you should eat a day for nice gastrointestinal health. The fiber that doesn't get broken down and doesn't attach to bile, and even the one that does bind bile, what happens is that they don't allow the stool in this area to become tight like clay. Imagine getting a piece of Play-Doh clay and rubbing it in sand. It doesn't become so plastic anymore. It loses its plasticity. It loses its ability to get different forms. So what happens is that it becomes bulkier, but it's not a hard bulk. See, what happens is that there's micropores between the connections of your stool, because this insoluble fiber allows for there to be little microscopic spaces, all right, millions of them, and water stays in there. So what happens is that as your colon and your small intestine try to absorb all this water from your stool, they don't do it. So your stool doesn't become rock solid, okay? Doesn't become rock solid because between all that stool you have particles of fiber that have not become digested, all right? They're partly digested, but 96, 94, 90% of it is still there, completely the same way that it came into your body. So what happens is that your stool doesn't become rock solid. Okay, yes, your stool becomes bulkier, but that doesn't irritate your gastrointestinal system because it becomes bigger and softer. And you know what it does? It gives your intestines a massage, and it promotes peristalsis, and it doesn't allow for you to become constipated. Constipation builds up pressure and causes over time, okay, we're talking about years and years, it causes weakening of your intestinal wall. So you want a high fiber diet. You want to tell people with diverticulosis and that have suffered from diverticulitis to eat a high fiber diet. It is a misconception that you should avoid seeds and avoid grains and avoid fiber in diverticulitis. Okay, look it up in JAMA, look it up in all these journals, and speak to gastroenterologists and look that up. And you want to make sure you educate your patients because it's been a misconception for whatever reason. And you should be sure of why, and I hope that now after explaining this you understand why fiber is good. Once a patient has had diverticulitis and they are tolerating clear liquids and they have been getting better with the antibiotics or operation, whatever they had, and they're getting better, they're tolerating now clear liquids, they start eating puree type of foods. As soon as they could tolerate that you tell them, or a doctor or a PA or a nurse practitioner says, listen, you could start eating normal food if you feel okay. They should also be told, with your food, make sure you get a high fiber diet, and if you want to eat seeds and eat nuts, it's okay. Can these seeds get stuck in the diverticula outpouching? Yes, they can, but so can stool. So can anything you eat get stuck there. It does not cause, and it has not been proven to irritate the diverticula or to cause diverticulitis again. If a patient says they have eaten seeds and they think after they ate seeds that they came in with pain, it could have been a coincidental finding. Okay, it could have been that even if they wouldn't have eaten seeds, they would have had irritation again for the second or third time of their diverticula. So it is a belief that people have that you should avoid seeds, and unfortunately a lot of medical professionals feel this way, but there's no proof that happens. Okay, if you want to be on the safe side and tell your patient to avoid seeds, that's understandable because you might not be too sure, maybe you haven't found the research to back you up, but do not let your patient leave without telling them how important it is to eat fiber. Okay, if you want to avoid seeds because you feel everyone is moving towards that movement, okay, fine, you could stick to that if you want. I don't believe in it, and there's a lot of evidence saying that it's a myth, but you know what, everyone's been doing it for a while. It hasn't necessarily meant that it's true. Just make sure that your patient understands they need to eat fiber because it will cause exacerbations of their diverticulitis, especially if they've already had it the first time. Okay, so your food completes a dehydration process. And one more thing I want to mention about the bacteria in this area, aside from the gas and fermentation that occurs in the colon producing gas, you also have swallowed air. Most of the swallowed air gets burped out or you get pushed back out. But a good amount of it also gets into your small intestines and into your colon. So the gas that you pass is a mixture of air and fermentation. This is important because after a patient has surgery and you want to see if their intestines start to work again before you give them some food so that they don't vomit. They have passed gas. It's a thing that you ask them, have you passed gas? They haven't been eating because of surgery, obviously, for maybe 24 hours. So the gas that they do pass isn't going to be fermentation from bacteria. It's going to be swallowed air, okay? But the swallowed air will not move if the intestines do not have peristalsis. So it's a good indicator after surgery, especially GI surgery, and the anesthesia is wearing off, to see if the patient's nervous system of the gastrointestinal system is working again, okay, when they pass gas, because swallowed air does travel all the way through. Bacteria also helps in producing vitamin K2. Our nutrition leafy greens provide vitamin K1, and they're both used for the coagulation factors, okay? So nutritional is a source of vitamin K, and bacteria also have enzymes to produce vitamin K from minerals that we eat in as our stool. By the time our stool reaches our sigmoid colon and our rectum, hopefully it's full and rich with fiber. It holds it here for not that long. By the time it reaches the sigmoid colon, instantly you're going to have the urge to go to the bathroom, okay? So understand that the urge to go to the bathroom and the nervous system from the lumbar plexus starts triggering the anus and the rectum to want to defecate, okay? Because the increased pressure of peristalsis by the sigmoid, that pressure is going to build up and affect your afferent and therefore your efferent nervous system of the rectum, and that's when you're going to want to go ahead and defecate. Hopefully now you guys have an understanding of how, in a clinical format, not going into too much detail, how absorption and digestion takes place and the normal function of the GI system. In the next video, we're going to start with pathologies of paralysis of the GI and infections and blockages and tumors and a lot of the pathologies that we could think about in GI.